Hello and welcome to the 21-day Dental Hygiene Department Challenge. I'm super excited that you're here. I'm going to walk you through what you can expect. And there are 3 steps at this point. If you've paid, we told you there are 3 things that you need to do. One of them is we are going to monitor and measure your progress along the way. So on day 1, once you're in the portal, you will receive some links, and I'm explaining to you how we're going to monitor and measure. So I like to have a board. It's like a dry erase board, and we always have our goals up there: new patient goals, hygiene goals, monthly goals. And maybe you don't have that right now, so hopefully you at least have a bulletin board in your office. One of the KPIs, one of the metrics, is this piece of paper. And since we're only going for 3 weeks right now, I have put this on an Excel spreadsheet, and you can see that we want to know exactly who's participating in the challenge. Definitely you want to have all the hygienists in the challenge, and everybody who's paid for registration gets the CE credits as well. So that's super important. And I've made it cost effective for people on your team to all participate. Super inexpensive to be a part of this, okay? There's this saying, people talk about it when they're raising children, and they say it takes a village. And that's exactly what it takes to be productive in the dental hygiene department. In case you don't know, I'm also a dental hygienist. I still work clinically because I know dental hygienists are far and few between. There's such a shortage. So at least once a month I work, and I love being a hygienist. But anyways, it's super important that we measure the things that matter. So when you look at this spreadsheet, we are going to be measuring 3 important points of your dental hygiene department. Super important. I call it the low-hanging fruit. It's the way that you can get the most amount of money coming into the practice as soon as possible, and that's reactivation of your hygiene patients. I have a reward system. It's a carrot that we give our patients, and it's called the club. And in case you don't know, I have the Celebrity Smile Club. And there are many offices around the world that use the club, but it's a great tool to reactivate your patients. Super important is to schedule that call with me that you've been given with this course, so I can explain more about it there if you're wondering. But it's a super great way to reactivate patients with a carrot and a reward for coming back when they're overdue. So we want to look at that number. Right now, I want to look at the 0, like they're due as of yesterday. They haven't scheduled an appointment. And what is your process? Maybe 6 months ago, there are people that were due, and we want to reactivate those people. A lot of offices have over 50 patients to reactivate, and that should be something you work on every day. Set a goal that somebody's actually going to reactivate those patients. I'm going to walk you through the web portal, and I'll show you that we've got video trainings on how to reactivate. The next area that we're going to monitor and measure is gingivitis and periodontitis. And in that module, there is an ebook. There's something for you to download and a calculation. Unless you have something like Dental Intel or Dentametrics, one of these dashboards, you need to run some reports and figure out what is your perio percentage. Usually an office is maybe 15%, but I'm going to share with you right now, I'll tell you that there's 47% of all adults in North America age 30 or above that have some level of gum disease, and I don't think that your dental office is any different. So know that number, that 40% of adults in North America, when they're age 30, they're going to have gingivitis or periodontitis. And our mission, and I'll keep saying this throughout the training, our mission is to help our patients live a longer, healthier life. That optimal oral health helps put a halt to other diseases such as heart attack, stroke, Crohn's disease, and most importantly, lately, there's been a wealth of research on the connection between the mouth, oral disease, inflammation, infection in your gums, that contributes to Alzheimer's, bleeding gums year after year after year, cause other systemic problems. And one of them we know now is Alzheimer's. So this is an important message to deliver to our patients. And I'm going to teach you how to say these words with your patients, because we'll talk about words and how they paint 1,000 pictures. And I'll teach you how to understand the words that are valuable to your patient and how to identify what's valuable to your patient without asking them what's valuable to you. The other area we're going to measure is the percentage of patients who are in a hygiene appointment, and then the hygienist actually walks them through what we see on x-rays, what we see in their mouth. Now, I know hygienists cannot make a diagnosis, but we can show our patients what we see, and we can kind of set them up. Like, I think of hygienists as being not only an adjunct to the doctor, but they're like a mini associate to the dental practice. And you as a dental hygienist, we can all work together to help the doctor not have to talk so much and explain so much when they're doing the exam. We've already, as the hygienist, set them up to hear that doctor's probably going to show them this hole or this area where there's bacteria sneaking in because there's an opening around this filling. I'll be teaching you those various types of words and phrases so that your patients will want what they need. This is super important. Everybody who enrolls, your office will receive 6 of the Celebrity Smiles teeth whitening kits. They come in this little satin bag, and this is part of the club. And then we're going to announce a winner of the challenge quarterly. So that means by January 5th, I think it's April 5th, July 5th, and then October 5th. I remember the dates correctly. That's about the time that I announce the winner, the winning team. And I send you a gift card of $100 to do with it what you want. But in order to win, you've got to participate. You've got to send in this to me within 30 days of starting the challenge. And you also need to schedule your 30-minute call with me, because I'm your guide. I am the expert that will help you not only achieve success, but set up systems to sustain your success. Now, next thing I'm going to do is walk you through the web portal of information. What questions do you have for me? Make sure that you email me, or you can call us. Email Debbie, D-E-B-B-I-E, at dentalpracticesolutions.com. And our number is 888-816-1511. Leave a message for me. One of those places, I will get back to you. Somebody on my team will get back to you, because I want to see you on the other side. It's exciting to see you succeed. I love seeing your success. So join me over here in the web portal. Okay, so here's the web portal, and what you'll do is you should have a link to log in. You'll have your email, a username, and password that's been given to you, and you'll go to Dental Practice Solution. You can always go here to the online training vault. You can always go here. These are all our trainings. And here is the 21-day Hygiene Department Challenge. So I've actually logged in. Here's the button where I log in. So you're going to be watching your orientation here, which you're watching right now. And then you will be getting certificates of CE each week. There is preparing for the challenge. This is very dynamic, and I'm always updating this. So I actually have changed this a little bit. I do want you to schedule your complimentary call. It's included in the challenge. I think it's very important that we monitor and measure what's important to us. Each day I start you out, and I'm actually re-recording these right now as I create this. So each day you get a video message from me, and then you have an ebook or a lesson. These are ways to keep your patients on the schedule. So you can see right here, there's a quiz. What do you say when patients to reactivate them? And again, this is day 3. You've got an ebook to download. Day 4, it goes like this. Every single day, there's something new, and there's a video message from me. So at the day 5, so I'm thinking that, you can all, like, you got your registration, but gather everybody together and start fresh on Monday. Or, maybe you're the dental hygienist and you can't wait, so you're going to start this weekend. So you can see here now is where you schedule for your 30 minutes with me, because I am your guide. I'm the expert to help you with the success. We've been doing this challenge since the COVID shutdown way back in 2020. And I have helped offices that are literally, after work, they actually decided to work with me for a year, and the doctor's practice grew so much. I mean, when somebody works for me in a big way, they grow. Like, we're talking 6 figures in a year from now, 6 figures more, $300,000, $400,000 more a year. And when you see these numbers where you are on that Excel document I was holding up in the video, you'll see that you have a lot of opportunity here, because I know you're not at 47% perio patients. And what is your case acceptance? I mean, what percentage of patients have a diagnosis in the hygiene room and then go schedule their appointment with doctor? We want to look at that. These things are all going to improve as we work together. This is week 2. We're going to dive into gingivitis. We're going to talk about case studies. We've got actual patients. I've changed their names. So I'm not divulging any personal information. It's all HIPAA compliant, but they are real life situations that occur. And we'll work on these case studies together, treating different stages of gingivitis. And then we have day 5 is always the time to celebrate and just look at where you are with your numbers. This is week 3, and this is the hygiene case acceptance. We have, what to say, what not to say. And you can see there's, video trainings here. And then always day 5 is time to celebrate and kind of take a look at where you are and what you've achieved this week. There's also a bonus course. So you will have that as well. And that's a course I wrote many years ago to crack the cancellation code. In 2009, I had so many doctors calling me and asking, how do we stop? Debbie, help me stop the hemorrhaging in the dental practice. So not only perio, but also helping to keep patients on your schedule is one of my areas of expertise. So if you have questions, you're not sure about registering, always reach out, Debbie, D-E-B-B-I-E, at dentalpracticesolutions.com. Our phone number is 888-816-1511. If you do nothing else, get that book, get a grip. It's really an easy read. And usually when I'm working full on, taking a deep dive with an office, we go through the book together. And this is where many offices, they've just soared big by reading that book and actually having this type of system set up in their practice, because I believe that it's important for team members to know what's expected. And then we have people that inspect to make sure what's expected is actually happening. So I will see you on the other side. Hope to see you in the training. Bye for now.